common question I get asked is, why won't my lumbar disc bulge heal no matter what I do? I've tried resting, stretching, even painkillers, but the pain just won't stop. Is there something I'm missing? Something that could finally fix this for good? Most people don't actually know the right way to heal a disc bulge, and because of that, they stay stuck in pain for years. Here's what they don't realize. There are 5 essential steps that most people never hear about that provide a proven roadmap to heal your lumbar disc bulge, stop the leg pain, and keep it from coming back. If you're not following them, your disc may never fully heal. And if you stay until the end, I'll reveal the one overlooked mistake that keeps people in pain for years, even when they think they're doing everything right. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome disc injuries, back pain, sciatica, and neck pain without invasive surgery and risky medication using specific chiropractic corrective techniques. If you're busy with work or home life and dealing with a chronic spinal condition, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies to relieve back and neck pain so you can move better, feel stronger, and stay pain-free. If you're struggling with a disc bulge, herniation, or a chronic spinal condition and want real, proven strategies to relieve pain, restore mobility, and prevent flare-ups, this channel is for you. Subscribe now to take control of your recovery and get back to living pain-free. Here are the 5 essential treatments for healing an L4-5 or L5-S1 disc bulge and preventing future flare-ups. Number 1, inflammation control and healing. When a disc gets injured, whether it's an annular tear, a bulge, or a herniation, the body's immediate response is inflammation. Now, this is a natural and necessary part of the healing process, as inflammation helps remove damaged cells and initiates tissue repair. However, in chronic disc bulge cases, this inflammatory response becomes a problem. Chronic inflammation doesn't just cause ongoing pain. It also leads to fibrosis and scar tissue formation around the disc and surrounding tissues. Over time, this stiffens the area, prolongs recovery, and can increase chronic pain. Additionally, inflammation around the nerve can cause swelling, irritation, and leg pain, making it even more difficult to heal properly. To break this cycle and allow the disc to heal, chronic inflammation must be reduced. And one of the best ways to do this is by correcting spinal misalignments that contribute to abnormal pressure on the disc. When the spine is misaligned, it places excessive pressure on the injured disc and nerves, keeping the inflammatory process active. Improving spinal alignment through specific chiropractic adjustments helps relieve pressure, allowing the body's natural healing process to heal more effectively. In addition to spinal corrections, there are several other effective ways to reduce chronic inflammation. Ice therapy, applied to the lower back for 10 to 15 minutes at a time, helps reduce swelling and numbness. Class 4 laser therapy and acupuncture have been found to provide relief for some people by promoting circulation and reducing inflammation. Inflammation control is the critical first step because it creates the right conditions for healing. If you skip this step, the disc remains irritated, the nerve stays inflamed, and true recovery becomes nearly impossible. This will lead us to the next step. Number 2, nerve flossing and mobility work. Once inflammation is under control, the next step is to restore nerve mobility and improve spinal movement, both of which are essential for long-term healing. Nerve flossing is a gentle but powerful way to help free up the sciatic nerve, which is often compressed or irritated due to a lumbar disc bulge. Over time, inflammation and scar tissue can cause adhesions along the nerve, making it stiff and more sensitive to movement. Nerve flossing helps break down these adhesions, allowing it to glide smoothly along its path. As a result, this reduces nerve pain, tingling, and numbness while improving overall leg mobility. Most patients notice less discomfort and better range of motion after just a few days of consistent nerve flossing. At the same time, lumbar and pelvic mobility work is crucial for preventing stiffness that could create pressure on the disc. If the lower back and pelvis don't move properly, the injured disc stays under stress, which prolongs healing and increases the risk of future flare-ups. This is why mobility exercises like cat-camel and seated pelvic tilts are key in this stage. The cat-camel stretch helps improve spinal mobility and circulation, reducing tension in the lower back and promoting fluid movement to the injured area. Many patients feel an immediate release of stiffness and better spinal mobility after doing this exercise regularly. Seated pelvic tilts are just as important because they help restore pelvic control and balance, ensuring the movement patterns don't keep putting excessive pressure on the disc. By improving pelvic mobility, you create a more stable, supported spine, which helps relieve pressure on the injured area and prepares the body for the strengthening phase of recovery. By incorporating nerve flossing and mobility exercises together, you're not just reducing pain, you're actively creating the conditions for your nerves and disc to heal properly. This step sets the stage for better movement, less nerve irritation, and faster recovery, making it an essential part of the treatment plan. Number 3, decompression and pressure relief. When it comes to healing a lumbar disc bulge, reducing pressure on the disc is key. Now, there are 2 parts to decompression, one that you can do at home, but another that requires a qualified doctor. The first is a do-it-yourself decompression exercise known as McKenzie lumbar extensions. While not a true decompression exercise, lumbar extension movements help relieve disc pressure by directing the bulging disc material away from the nerve. This can provide a lot of pain relief, as many patients feel an immediate relief in leg pain when performing extensions correctly. McKenzie extensions can be done lying on your stomach, which is the preferred method if it's tolerable. For patients who can't tolerate laying face down, standing lumbar extensions can be performed throughout the day as an alternative. The key is to do these movements consistently and within a pain-free range of motion to allow the disc to recover naturally. Next is the doctor-guided decompression known as spinal decompression therapy. While McKenzie extensions provide some relief, true spinal decompression requires the help of a trained professional. Spinal decompression therapy is a gentle, non-surgical treatment designed to relieve disc pressure by creating negative pressure inside your spine, which helps the bulging disc retract back. Spinal decompression is performed with a specialized table that gently stretches the spine, creating a suction effect inside the disc. This reduces pressure on the compressed nerves, helping to relieve pain, numbness, and tingling in the legs. It also increases fluid exchange in the disc, which helps with faster healing. Now, unlike traditional traction, spinal decompression uses controlled, intermittent stretching to prevent muscle guarding and ensure a comfortable experience. It's completely safe, gentle, and highly effective, and most patients find it relaxing and pain-free. In fact, our patients love it because it provides a lasting relief without medications or surgery. Backed by research, spinal decompression has been shown to help reduce the size of the disc bulge, improve mobility, and decrease chronic pain. That's why it's important to find a spinal decompression certified doctor in your area who can offer this treatment as part of your recovery plan. By combining McKenzie exercises and spinal decompression, you're giving your disc the best chance to heal by removing the pressure that's keeping it inflamed and irritated. Number 4, core stability and strengthening exercises. Next is core stability and strengthening. And in case you're wondering, yes, these treatment steps are done in a specific order for a reason. You can't jump straight into core exercises when you're in severe pain and dealing with inflammation. The body just isn't ready for it and would only increase irritation to the disc and nerves. That's why core strengthening comes after decompression. By this time, you've already made significant progress. You're experiencing better spinal alignment, reduced pressure on the disc, and in some cases, even disc resorption. Now it's time to reinforce those changes by building strength and stability in the muscles that support the spine. Core stability exercises play a crucial role in offloading pressure from the spine, helping to prevent re-injury and future flare-ups. When the deep core muscles aren't strong enough, the lower back takes on too much stress, forcing the discs and joints to absorb excessive force with every movement. Strengthening the deep core muscles like the abs, obliques, and multifidus creates a natural brace for your spine, allowing it to function with better support and less strain. These muscles work together to maintain proper posture, control spinal movement, and protect the discs from excessive pressure. One of the most effective exercises I teach my patients is the bird dog. It strengthens the core while also improving balance and coordination. By extending one arm and the opposite leg while maintaining a neutral spine, you're training the core to stabilize when the limbs move. And this is a fundamental skill for everyday activities. Another highly effective exercise is the prone plank, which engages the entire core, building in the endurance in the muscles that helps protect the lower back. For those that need additional lateral stability, side planks help target the obliques, preventing unwanted rotational stress on the spine. And for strengthening the glutes, another key player in lower back stability, the bridge is a go-to movement, helping to reinforce proper hip and spinal alignment while reducing strain on the lumbar discs. Each of these exercises is introduced gradually, ensuring that they are done with proper form and without aggravating the injury. As the core gets stronger, the spine becomes more stable, movement becomes safer, and the risk of re-injury is dramatically reduced. This is where real, lasting improvements start to take shape. A strong core means less pain, better function, and long-term protection for your spine, making this as an essential part of the recovery process. And now, number 5, movement patterns and lifestyle adjustments. You've gone through the key phases: reducing inflammation, restoring nerve mobility, decompressing the spine, and strengthening the core. But if your everyday activities continue to put stress on your spine, all that progress can be undone. This step is about reinforcing everything you've gained so far and preventing future disc injuries. One of the biggest mistakes people make after they start feeling better is going right back to the same habits that contributed to their disc injury in the first place. Poor posture when sitting, improper lifting mechanics, and prolonged static positioning all create repetitive stress on the lower back, increasing the risk of re-injury. Even small adjustments, like maintaining a neutral spine while standing and sitting, engaging your core before lifting or bending, and avoiding excessive forward flexion can make a huge difference in keeping your discs healthy and preventing further damage. A key part of this phase is gradual activity progression. Too often, people start doing their rehab exercises once they feel relief, only to experience a setback later. The truth is, spinal healing is a long-term process, and staying consistent with mobility work, core strengthening, and decompression techniques is what ensures the disc fully heals and stays healthy. If you suddenly return to high-impact activities like heavy lifting or prolonged sitting without keeping up with your spinal care routine, the same pressure that caused the disc injury in the first place will start building up again. This is why movement training is essential. Learning how to hinge your hips instead of bending at the waist, distributing your weight evenly when standing, and avoiding excessive spinal twisting all helps reduce unnecessary stress on the discs. Sleeping posture is another key factor. Using proper support while sleeping can prevent awkward positions that strain the lower back overnight. Footwear also plays a huge role. Wearing unsupportive shoes can throw off the pelvis alignment and increase spinal stress. By making these small but powerful adjustments, you reinforce the correction your spine has gone through the first 4 steps. Your body now has the strength, mobility, and alignment it needs to function well, but your daily habits will determine whether you maintain that progress or fall back into patterns that create pain and injury. This final step is what keeps you not just pain-free, but resilient, active, and able to move without fear of re-injury. Now, here's your bonus tip. The biggest mistake that keeps people in pain is stopping too soon. Just because the pain improved doesn't mean the disc is fully healed. Many people feel better after just a few weeks and then go straight back to their old habits, sitting too long, skipping exercises, or moving in ways that strain the spine, only to have the pain come back, sometimes even worse than before. Healing a disc bulge takes time. Disc tissue repairs slowly, and if you don't stay consistent with treatment, your mobility exercises, your core strengthening, and proper movement mechanics, you risk undoing all of your progress. Don't treat this as a short-term patch. The key isn't just starting the right treatment, it's sticking with it long enough for real, lasting recovery. Dealing with a disc bulge or herniated disc is one of the most excruciating experiences, but no matter where you are in your healing journey, don't give up. With the right treatment approach and the right guidance, you can recover, experience permanent relief, and get back to living a normal life. If you got value from this video, like and share it. If you have a question, drop it in the comments below. I'm here to help. Subscribe now if you want more proven strategies to heal your spine, relieve pain, and prevent future injuries. And if you're wondering how long it takes for a disc bulge to heal, I answer that question in the next video. Go watch this video next.